So that was the first thing. The second thing is another phenomenon is happening here. Sodium ions are the positive ions when they are moving inside. Okay? Well, they cause an attraction force for the negative ions which are present in the lumen. The negative ions which are most commonly coupled with the sodium, as you know, are the chloride. So when the sodium is moving, the chloride is also following, and it takes the passive route also. So sodium, chloride, they are moving usually together most of the time, and they can pass through the tight junctions, paracellular pathway, and they can pass through the transcellular route, which is through the cell. Okay? You know the meaning of the pinocytosis. I'm not staying here because the vesicle formation is very easy. If a substance is a big substance, protein or a larger hormone-like molecule which is filtered and we want to reabsorb it, then the best way is the pinocytosis, engulfing. Okay? Okay, now we are coming to a very important concept, the primary and the secondary active transport. Yesterday you gave me a very good example of the primary active transport sodium potassium pump. Okay, and then we said that when we use the word pump, we mean to say the primary active transport. Now we know that. Okay, but the secondary active transport is supported by the primary active transport, which is mojood very close to it. Okay, now remember two things. Look at this picture. Identify the lumen and identify the base of the cell. Which side is the lumen and which side is the base? Okay, right and the left side. Interstitium is mojood on that side, lumen is mojood on this side. Now focus the cell and look at the cell, identify where do you find the primary active transport and where do you see the secondary active transport. Okay, all right. So primary is present at the back side or the front side towards the lumen. What do you think? Back side means interstitium, front side means lumen. Which side do you see the primary active transport? Primary. Interstitial surface of the cell, isn't it? Okay. Remember, sodium potassium pumps are unique pumps in all the cells of the tubules. They are mojood because they are vital to every cell. Okay. It is lazim to have these pumps. And remember one striking fact, sodium potassium pumps are only present on the interstitial surface. You will never find them on the luminal surface. You try, you see, you search books, you discover anything, but till now we have not seen any sodium potassium pump on the luminal surface. It is always present on the back surface or the basal or the interstitial surface. Okay. One more thing. This surface is the basal surface, okay? And this surface of the cell is the lateral surface. It is the lateral surface of the cell, okay? If I combine these two surfaces, then I will use one word for the combination. What will be that word? Interstitial, it is there, okay? You can call it. But by combining these two words, basal and lateral, make a new name, come on. Basolateral, that's it, okay? This is what you have to do. So this surface of the cell, okay, sides and the back is together known as the basolateral surface. Did you get that? Sodium potassium pumps are always present on the basolateral surface. It may be the basal surface or the lateral surface, but never on the luminal surface, remember, okay? Give me a second, please. I'm sorry. Hello? Ji, walaikum assalam. Ji. मालूम कर सकूँगा, या फिर मेरा तो डॉक्टर फरजाना टाइम लगेगा। मेरा ख्याल है आप ऐसा कीजिए, क्योंकि आपका भी टाइम फिर ज़ाया होगा। आप मोइन को ज़रा फ़ोन में लाइए और उनसे कह दीजिएगा, बल्कि शायद मोइन अभी ना पहुँचे हों, मेरा ख्याल ये है। Okay. Now please. So from this diagram, we are just looking at the diagram still, and we have found that sodium potassium pump is present on the basolateral surface. You will not find it on the luminal surface. This is point number one. Now you come to the luminal surface of the cell and see what kind of transport processes are there. Okay, these are secondary active transport. All right. Now, can you identify the transport processes which are shown here? The first one on the top is sodium and glucose. If sodium and glucose are going together on one side into the cell, what will you call this process as? Symport or co-transport. All right, it's a symport or the co-transport. Great answer. So sodium glucose co-transport is shown here. Okay, come down, look at the second process. What is that? Sodium amino acid co-transport. Do you see that? Okay, it's also symport. Come down further and see another process. What is that process? Is it a secondary active transport? Yes. Counter transport. It's not the co-transport. Salman is saying counter transport. Counter means the two substances are moving in opposite direction. Do you see that? Okay. Do you see what he sees? The same thing? Great. So third one is counter transport. But what do you think? This counter transport, is it a type of secondary active transport? Yes or no? So all transports shown in this diagram are secondary active transport. Some are co-transports, one is counter transport. All are present on the luminal surface in this diagram at least. One more thing about this diagram is common. Look at the secondary active transports. What is common about these? Sodium. Okay, sodium is present in every case, isn't it? Sodium is the helper, and the second substance is going along with the sodium, glucose or amino acid or hydrogen ion. Okay, now identify, very interesting part of the story coming now. Look at the first one. Okay, sodium glucose co-transport. Okay, now you have to see how it is a secondary active transport. What do you mean by it? Do you remember the principles of the active transport? Okay, do you think all these principles are present here? If you are calling secondary transport, be careful. You have to prove that all three are applied here. Okay, number one, against the concentration gradient. Now what do you say against the concentration gradient? Sodium, look at sodium and look at glucose. Okay, you have to analyze one by one. Sodium and glucose, look at that. What do you think about sodium? Sodium is coming from the lumen and it is going into the cell. On which side do you have more sodium, lumen or the cell? Lumen, definitely, because it's coming from extracellular fluid. High sodium is present in the extracellular fluid, right? And in the cell you have a little amount of sodium always, isn't it? So sodium is moving from high to low or low to high? So what do you say about, is it a secondary active transport? No, no, it's not. Still we are calling it secondary active transport, right? Look at the other substance, which is glucose. Okay. In this case, where do you find glucose more, inside the cell or outside the cell? Okay. In case of the kidney cells and in case of the GIT cells, you have a larger amount of glucose present inside the cell as compared to outside. In these two areas actually. In other parts of the cells, in other liver and other, glucose is quickly converted into the glycogen, or glucose is used up in the glycolytic pathways. Okay? So the quantity of glucose is low in other cells of the body. But especially in the case of the kidney cells here, or the case of the GIT cells, when you are absorbing the glucose, large amount of glucose is present inside the cell, okay, and little less amount of glucose is present outside the cell. Now, if glucose is more in the cell and less outside, what do you say about the movement of the glucose? Is it against the concentration gradient? Okay, so now it's very confusing. One part of your picture is telling you that it is not secondary active, and glucose is telling you it is secondary active. Overall, you are calling this transport as secondary active transport. But imagine this transport is secondary active transport because glucose is moving from low to high. Okay? If you look at the sodium, that part, you will not call it the secondary active transport of the sodium. It is a secondary active transport of the glucose. Okay? What is the term used for the sodium? Think and answer. Think and answer. Think and answer. Sodium is attaching, sodium is going inside, sodium is going from high to low concentration. Now, what is your answer about sodium? Give me one answer. Think from yesterday's discussion and answer the question very quickly. It's the carrier mediated. I am sure about that. You are sure about that? Very good. Okay, it is the facilitated diffusion of the sodium because sodium is attaching to the carrier and carrier is taking that diffusion. So sodium part, if you look at sodium part, you'll say, this one is the facilitated process. But the lower one, glucose, is the secondary active process. Do you see that? Okay, so you have to analyze like this actually. Just don't believe that the whole process is the secondary active transport. It's not like that. Okay, always think. What do you think about the getting back. Sodium glucose co-transport is the secondary active transport. Now, where do you get energy for this transport? ATP? Do you see any ATP here? Okay, do you see any ATP here? This side, I'm saying. Is ATP written here? No, it's not. ATP, no ATP. No ATP. That's why it's secondary, isn't it? No direct ATP is involved. But still it's a secondary active transport. It needs energy. Where is energy coming from? Glucose is only getting attached and going inside. Glucose is not metabolized. Glucose is not breaking down. Glucose is not giving you energy. So again, it's not coming. So what do you think? ATP? ADP. But Hussam, where is ADP here? Do you see ADP here? Sodium. You're saying sodium. How is sodium giving energy here? How do you get energy from sodium? By? Okay. All right. Look, first of all, yes, Abdullah. Very nice. I'll combine two answers, yours and yours, Abdullah. Thank you very much. Okay. Look at this one. What is this pump doing at the back side? First of all, tell me. It's active transport. It is pumping the sodium out or in? Out. If it's pumping the sodium out, what will happen to the sodium inside the cell? Low or high? Decreased. No. Just look at this pump. If it is pumping sodium very quickly out, okay, 3 sodium, 3 sodium, 3 sodium out. So what will happen to the sodium inside because of this pump? Decreased, okay? If the sodium is decreased inside because of this pump, low concentration is maintained by the sodium pump, isn't it? Okay? This is actually driving the sodium from outside to inside. Now sodium is attaching on the secondary active transporter and it's coming. So the force of this pump, this sodium, is depending on this sodium. When this sodium is going out, then you have a low sodium here. When you have a low sodium here, then this sodium will come inside. If you already have a high sodium here, can this sodium come inside? No. It means you are depending on which pump? The sodium potassium pump. It means the whole process is driven by or controlled by the sodium potassium pump or the primary pump. Okay, I told you in the beginning, secondary active transport usually depends on the primary active transport, which is موجود close in the nearby region. Did I tell you that? Okay, so do you see this diagram now? So primary active pump is now helping the secondary active transporter, and that's why it's coming. Sodium is the main driving force because sodium is moving this molecule, and the glucose is now also going. Glucose cannot go alone. This is a problem. Glucose cannot go from low to high. If glucose attaches, okay, then if I'm a driver, okay, and I'm driving the car here, okay, and you are standing here and you cannot go there, okay, what will you do? You will take a lift that, can you drop me there? So I'll say, okay, come. So you will sit in my car and I will drive the car and I'll take you there, isn't it? Sodium is the driver of the car and sodium is taking it, and glucose is sitting as a passenger, and then glucose can go. Alone, if glucose is موجود, glucose cannot go, because how can it go? Against the high concentration, okay? So this is the reason. Look at the relationship of the primary and the secondary active transporter. So secondary is depending on? Okay. Same case here, and same case here, only the direction is opposite, okay? Sodium is the main driver of these transporters, and that's why these substances are moving in, or maybe hydrogen is moving out. Okay, did you get that? This is why you call it the secondary active transport. It is using indirect form of energy, not the direct form of energy. Okay, so energy is coming from the sodium source, and that sodium source is developed by the primary active transport or the sodium potassium pump. Am I clear? Shabab, did you get that? So this pump is working and this carrier is depending on this pump. If you block this pump, for example, if I block this pump, what will happen to the sodium inside the cell? Increase. After some time, what will happen to this pump? It will stop also, because there is no use now. You cannot operate the pump. So primary pump is main driver, and then secondary pump is working due to the primary pump, and it's taking its energy indirectly from that. It's taking its working force from that. All right. Yeah?
No. The sodium.
Yeah?
Depending on the pump.
This sodium?
No, that's
this one? Yeah. On the pumping activity of this one, because if you pump this sodium, then you will maintain a low sodium inside the cell. And when there is low sodium, then only this pump will work.
It's using indirect energy.
Yeah, indirect energy, because if you don't provide energy to this pump will stop. And if you don't have this pump working, then sodium ions will stay inside.
Before we said that passive transport does not do the energy.
It is not, yeah, you're right, okay? It is not the passive transport basically, it is the whole pumping activity. Look at the glucose movement, okay? This sodium diffusion even depends on the low sodium concentration. Here you have to have from high to low concentration. By using energy, you are maintaining the low concentration. By maintaining the low concentration, you are having the driving force, and this driving force is helping the glucose. Look at that way actually, okay? For this transport only, okay? If only sodium you are considering, it is going from high to low concentration. But even if this pump is not working, will you have this diffusion? No. So diffusion will be affected by the concentration, and concentration is controlled by primary source. So that's why we are saying
it's... What do we call this sodium transport is facilitated?
Because, look, number one, sodium is attaching to the carrier, okay? Yeah.
If it's using energy.
Yeah.
How do you call it?
I will call it facilitated transport, okay? Because it is moving from high concentration to low concentration, okay? It is not using the direct form of energy, okay, as ATP, but by chance this low concentration is maintained by the ATP activity. Okay, that's why you call it. So in a way, you are right also that it is not completely satisfying the facilitated diffusion also, but it is still a facilitated type of transport because you are using the carrier and you are moving from high to low. So it means you are satisfying that. Okay, and you are not using like ATP as an energy direct source. So still you classify this as the facilitated diffusion. Okay, by looking at the main points of this activity, it seems like a diffusion. Okay. Now, we are very quickly starting the proximal tubule, please. Okay. Proximal tubule is using, please, many transports. I'll give you only a little summary. Proximal tubule is the most important area, please remember. Of the major substances which are coming into the proximal tubule, about 65% of the water and major electrolytes like sodium, potassium, chloride, and more than 65% of bicarbonates, they are absorbed, reabsorbed from the proximal tubules. 65% of the water and 65% of the sodium chloride along with potassium and even more bicarbonate ions, they are simply going along with water in this direction. It means major substances, they are absorbed in the percentage of about 65%. Out of total 100%, 65% is taken back by the proximal. You are only left with 35%, which will have some reabsorption in other parts, loop of Henle, or maybe the distal tubule, or maybe the collecting ducts. We'll see later, okay? But 65%, the major part, 2/3 of the total quantity is taken back by the proximal tubule. That's why we say proximal is the most important. It has the largest surface area, it has the biggest part, maximum number of cells, the best cells for reabsorption, full of energy processes, maximum carrier transports, maximum primary active and secondary active transport is present in the proximal tubule. So the best area qualitatively and quantitatively for the absorption of almost all substances is proximal tubule. Okay, you will see so many substances are written here. Now, some substances show diffusion, some will show primary active transport, some will show secondary active transport. That you will have to learn really. Okay, well, simply you will see chloride, sodium, urea, some waste products like urea, uric acid, they are diffused. Okay, water and osmosis, you know these two terms we have discussed yesterday. Okay, larger substances like proteins, if you want to reabsorb them, obviously you have only one choice, and that's pinocytosis. All right. Now, I told you 65%, remember figure 65% is very important. Sodium, chloride, water, okay, and a very important point about the proximal tubule is that it handles the very important substances like glucose and amino acids, okay, which are very vital to the body. You can't lose them in urine. We talked about glucose, that usually glucose does not pass into the urine. Okay, if in 24-hour urine if you collect, you will hardly have traces of the glucose, which is negligible. We don't really consider that, but in one void of urine when we pass, it does not have glucose under normal conditions, except when our blood glucose level is very high in exercise, or maybe we have taken a large amount of sugar and the level goes very high. At that time maybe a little glucose can come, but not most of the time. It's zero. Okay, anyway, so you have to reabsorb glucose completely, I told you, isn't it? The best area for the glucose reabsorption is the early part of the proximal tubule, the first part of the proximal tubule. It takes back the glucose really, all of it, almost. So glucose is 100% reabsorbed. Amino acids likewise are very important. They are also almost 100% reabsorbed. Okay, we claim about the vitamins also, that vitamins are also reabsorbed close to 100%, or almost all vitamins are reabsorbed which are filtered. Okay, so glucose, amino acids, vitamins, going back completely from the proximal. 65% of water and the major electrolytes, sodium, chloride, potassium, and also bicarbonate in very large amount. Okay? All right. Secretion. Proximal tubules also secrete few substances, please. That is very important. Okay? I'm sure you know the word creatinine. Creatinine. Are you familiar with creatinine? It's a waste product. It's a metabolic waste product. Okay? Where is it coming from? Muscles. Thank you. Okay? It's creatine is present in the muscles. Creatine is changed into the creatinine. It is the anhydride form, and then it is excreted, released into the blood. So it's continuously coming from the muscles because muscle metabolism is going on, and this creatinine is continuously excreted from the body. It is the waste product. But creatinine is also very valuable for us in checking the renal function, because if the creatinine levels are normal, okay, it means your renal function is going normal. Your GFR is normal, your renal function is normal. If creatinine level is increasing by some chance, then in that case, there could be a problem. You have to investigate carefully. Is kidney function normal? Why is creatinine getting raised? Okay? So high creatinine is usually an indicator of some abnormal renal function. It means GFR is going down or kidneys are not doing a good job. They are not filtering the substances properly. Okay? So we check by creatinine. Okay? We check the creatinine in the blood, and that gives us an idea. Okay? Many drugs, many metabolites, many substances, they are also secreted from the proximal tubules. Penicillins and other drugs, when we give them to the patients, well, mostly they are secreted by the cells. Okay? So many drugs are secreted from the proximal tubules, and they are coming and then they are going in urine. Okay? Many metabolites of our metabolism, they are also secreted. Some conjugated substances, some acids and some bases, they are secreted. Okay? Well, two very special things. Proximal tubule is continuously producing inside the cells. Two processes of synthesis are also going. Okay? One is hydrogen ions, because hydrogen ions are formed in a very special way, and then hydrogen ions are released actually out of the cell. When they go out of the cell, well, they are dangerous ions. Hydrogen means acid, isn't it? It can damage, so you can't leave them free. Then somehow you will buffer these ions. Later we'll talk about acid-base balance, but hydrogen ions are produced by the cells inside the proximal tubular cells. Not only proximal tubular cells, many parts of your tubules, distal tubules, collecting ducts, thick loop of henle, many parts are producing hydrogen ions, and the same parts are also producing a very special molecule. It's a gas, and what is that? Ammonia. Okay, NH3. Ammonia is another very important thing which is produced, and that ammonia is also released into the lumen. Okay, then it also undergoes the buffering, and it helps in the buffering reaction. It becomes ammonium ion. We'll see later. But two very special substances are synthesized and released. One is hydrogen and the other one is ammonia. Okay, keep it in mind, please. Okay. All right. This is a summary of the processes. I'm not discussing. You will see this diagram later, that how many things are going. Sodium is a great helper of many substances. I gave you only few examples of sodium. Sodium, glucose, amino acids. Sodium is helping vitamins. Sodium is helping many other things, even fluoride as a transporter. And sodium is helping many organic acids and bases which are not shown here, but many drugs and many organic acids, bases and metabolites are secreted by the help of the sodium also. Okay, so sodium is very important. All right. After completely analyzing the proximal tubules, you will have to see this graph. Okay, and this graph will tell you that As you are passing from the beginning of the proximal tubule to the end of the proximal tubule, you will see that the different substances are decreasing in the quantity, or maybe they are increasing in the quantity. Okay? See, look at the line, the horizontal line. Okay? Tell me one thing. What substances are increasing in quantity? What do you think? All right. And what other substance is increasing? One is urea.